Dr. Koehler, welcome to the show.
Justin, thank you so much for having me, man. I appreciate it. It's good to be here.
Yeah, I'm excited to have this conversation with you because a lot of what you do is a hot topic right now in the world, right? We're talking about weight loss medications, we're talking about testosterone replacement therapy, and all
Yeah.
these things that I feel like people hear about, but because of the internet, we don't know what's real, what's not real, how do we approach it in our own way, right? So why don't we start with who are you today? And then we're going to break down how you got there. We'll get into all the nitty gritty.
Sure, absolutely. Thank you. And you're definitely right. I mean, there are a lot of misconceptions about, these medications out there. You never know what to believe. But it's really my job and our job to know these medications better than anyone else because that's what our clinic does. So I'm the medical director of Affinity Whole Health. We are a clinic that specializes in weight loss therapy and also hormonal therapy for our patients. We really just try to get our patients to feel better and also get healthier at the same time. That's pretty much our job.
Yeah, I love it. And so obviously right now the hot button is the Ozempics, the GLP-1s, all that fun stuff. And a lot of people are talking about the negative side of things, but you guys utilize this and work with your patients from a positive standpoint to make sure it's being taken the right way, making sure it's healthy. Tell us a little bit about kind of where these drugs came from and why did they explode on the scene so heavily in the last 6 months to a year?
Sure, absolutely. So these medications are part of a drug class called GLP-1 agonist. GLP-1 stands for glucagon-like peptide 1. It's actually a natural peptide that's made in the gut in our bodies. I mean, it's naturally made, right? And so these medications, researchers found out, hey, this peptide GLP-1, not only can it help control blood sugar levels, right, in diabetic patients, which is why these medications were initially produced, but they also help those patients lose weight as well. And so I think the good news about these medications is that they're very heavily researched. They are not new. I mean, they've been researching these for over a decade. I mean, years and years of research and data have gone into them. So we know a lot about them. We know from many large randomized double-blind placebo-controlled trials what to expect with patients, what the benefits are, what the potential risks are as well. And so they're not like a supplement that someone started taking a few months ago and now everyone wants it. I mean, these are medications that have been very heavily researched and continue to be researched and really finding more and more benefits of them. So that's kind of where they came from. And now, of course, you have people who are getting great results. And so they're posting things on social media. While at the same time, not every medication comes without its potential side effects. The good news about the side effects of these medications is that they're pretty rare and they're actually very minimal. And a lot of them have to do with just the dosages. And so, it's really getting that individualized dose, which is what we are able to provide to our patients that can really help you get on track, lose the weight you want while also feeling well and not having those untoward side effects.
Yeah, how does this drug work, right? Because I think throughout my lifetime, I'm 40, just to put it in context. So
Yeah.
throughout my lifetime, there have been so many miracle drugs or
Yeah.
supplements that have come out to help people lose weight. These ones, obviously, they seem to be working, right? But what is it actually doing inside of your body to kind of help you through that weight loss journey?
Sure, and this goes back to what GLP-1 does in our body, right? Because that's what these medications do. They activate that, they mimic that. And so there's two main mechanisms that these medications help patients lose weight. One is that it's an appetite suppressant. So people love that. I mean, really, what a lot of patients say to me is it kind of eliminates that food noise. So like, if you've had a stressful day and you just want to eat something that's probably not good for you, or if you're just at home and kind of bored and you just want to eat something, that food noise that a lot of us have because we're just trained to eat, right? So the appetite suppression's number one, right? So that decreases cravings and really just cut down your overall hunger. So you don't have that big desire to eat a lot, right? The other mechanism that helps patients lose weight is they actually delay the process that your stomach can empty its contents. So the end result of that is then when you eat a meal, you feel fuller more quickly and for a longer period of time. So not only are you full and you don't feel like you want to eat a large meal at once, you're just not going to feel like it either because you have that appetite suppressant effect.
So essentially, what it's doing is it's portion controlling what you eat.
That's exactly it. And that's the beauty of the medication, right? You don't have to do a crazy, zero carb, zero this, and cut out that and fast and all these other kind of things that come out every single year, right? That's why there's so many diets out there. All it's literally doing is making you control your portions, right? I
Yeah,
mean,
yeah.
and again, it becomes something where it's a little bit difficult to describe until you're on the medication. you just don't feel like you need to eat that much anymore, and you feel when you eat a meal, a normal size meal, you feel full and it's a lasting thing. You're not hungry 2 hours later. Interestingly, there was a study out of Ireland done recently where they were looking at, hey, are these medications, is it just the appetite suppression and the fullness that's causing patients to lose weight, or are there other things going on? And what they found, it was a small study, but what they found is that patients on these GLP-1 medications, this was looking at semaglutide in particular, which is the original weight loss medication. They actually found through CT scanning, when they were looking at these patients' visceral body fat, which that's the body fat that's inside your organs. That's the bad body fat, right?
Yeah.
And they're looking at that body fat with patients on these medications. It looks like that body fat is becoming actually metabolically active. So they're looking at the mitochondria, which are the organelles inside the cells that actually create energy and use energy. In that fat, they're actually becoming active. So there might be more than two mechanisms that are helping patients lose weight. It might actually help your metabolism as well. Pretty cool.
Yeah, that's interesting. Obviously you're talking about like something like fatty liver. So this could potentially
Yeah.
down the road be used just to kind of treat a fatty liver disease or whatever somebody might be suffering from.
Exactly, because when you look at the data, right? Yes, we know it helps you lose weight. Yes, we know that it helps control blood sugar levels, which again, diabetics, when they have high blood sugar levels, that's terrible for your vessels in your body. It's very inflammatory. So controlling that is good. But it's really that visceral fat around your liver, around your intestines, that is really bad for you and leads to all those really bad cardiovascular issues, right?
Yeah. So when you're looking at this, who do you feel as like who do you guys look at and say, okay, you should be on this drug? Like, what are some of the components that you guys look at? Because it's not for everybody.
Yes, that's correct. It's not for everybody. And, patients come to us because they have symptoms. They don't just come to us because they feel great, right? They know there's something wrong. Like they're working out, they're trying to eat well, they can't lose the weight, they don't look the way that they want to. So in terms of that, that makes my job easy because we already know what they're coming to us for, right? But really, there are very few contraindications to using this medication. And really, increasingly, with more and more data, the potential side effects of these medications, a lot of them are just very overblown. I mean, so you can take something, if you had someone who had really bad gallbladder disease or had a history of pancreatitis, which is where your pancreas organ gets really inflamed, there's a potential risk of making those things worse with these medications. So for a patient like that, I would say, you know what, the risk is there. We probably shouldn't give it to you. But really, those potential side effects already in studies, they've been showing, hey, you know what? Maybe this doesn't really happen at all. So a lot of these potential side effects make the medications even safer for patients who need to lose weight. So obviously, the biggest portion of patients who could use these medications, besides the diabetics, because we don't treat diabetic patients in our practice because we're not playing primary care doctor, right? We only use these medications for weight loss. Patients who are obese, which strictly speaking, that's a body mass index of 30 or above. Patients who are overweight, which is a body mass index of 25 or above, or we actually have patients who come in to see us in the office, and we have a special in-body scan that'll, aside from just measuring your weight, it'll tell you your body fat percentage, it'll tell you your lean muscle mass, it'll tell you honestly, more important things than just weight. And so if we have someone who has a high body fat that's over what it should be, that's another patient who could benefit from these medications.
Yeah, so I'm glad you brought up the body scans because obviously one of the side effects that I've seen is potential muscle loss. Like you're losing muscle, not fat, right? So what are you
Yep.
seeing in your patients when they're coming in? I'm sure you're scanning them throughout the process. What are you seeing? Is that an actual side effect that a lot of people are experiencing?
So the interesting about this is that, the way that these medications work, right, is it just takes your calories down. So, losing weight, if we're just talking about weight, strictly speaking, it's all about calories in, calories out. But you hit the nail on the head. What you really want to do is just lose fat. The muscle mass you have, the bone mass you have, the water you have, and you want to retain that. You just want to lose fat. And so when you're on a weight loss journey, on these medications specifically, isolating fat can be difficult, but we have several techniques that we coach our patients on initially. Number one is make sure that your protein intake is adequate. I mean, it really, protein are the building blocks of lean muscle. You can work out all day long and lift weights all day long. If you're in a caloric deficit, and especially if you're not taking in enough protein, you're going to lose muscle. That's the way it works, right? So getting in enough proteins, number one. incorporating some type of strength training in your exercise as well. You know, cardiovascular activity, it's great. If you love running or if you love cycling, that's fantastic. I tell patients, though, you need to treat strength training and cardiovascular training as 50-50. They're both equally important. They both have certain different benefits that brought together really help your health in the long run. So strength training helps as well, good protein intake. The other method we tell patients too is don't lose weight too quickly, right? I mean, so we're all human. We want results really quickly. We all want to look fantastic in a couple of weeks if we could, right? That's not the way to do it. You know, you want to lose weight slowly. And so, you know, our patients can come in and do an in-body analysis as often as they want. We don't even charge them to do that. A lot of clinics
Wow.
do. But a lot of them, you know, don't want to come into our office every month or every week or et cetera, right? They'll come in every few months just to see where they are. And so I tell patients that, you know, it's a once a week injection. That whatever day of the week you decide to do your injection, weigh yourself first thing in the morning. Don't weigh yourself later in the day, you know, because it's going to be inaccurate. Don't weigh yourself every day because you're going to naturally fluctuate and that's going to drive you crazy, right? Weigh yourself every week and take a log of that, right? If you're losing more than 2 pounds of body weight per week, and we're just talking about body weight here, it's too fast. It's almost impossible to lose more than 2 pounds of pure fat per week. So if patients are losing 3 or 4 pounds per week consecutively, they're losing muscle too, and that's not good. They got to slow down.
Yeah. And so it's fascinating. Now, part of this process, are you teaching these individuals how to properly eat? Because here's the thing, right? Like I look at drugs in general as something to help you in the beginning and then hopefully get off. And this is everything from
Sure.
mental health drugs to everything else, right? So we
Yeah.
don't want to be on Ozempic for the rest of our lives, right? We want
Yeah.
to make sure that, hey, this is just helping me in the process because I've been having some issues. So what are you guys doing to help support them post Ozempic? Because then their hunger comes back, all that stuff.
Sure. And that's another thing too, that again, if I like looking at social media to see what people are saying about these medications all the time, because those questions will come up from our patients.
Yeah.
So I know, oh yeah, they were saying this. I saw that too. So one of the myths about the medication is that, and I've seen this on social media, you know, a person loses a ton of weight, they feel great, and they say, you know, they come off the medication for whatever reason, and they like bounce back and they gain more weight than they had before. That doesn't happen. If you look at the actual data in the original clinical trial, and let's talk about semaglutide in particular, the brand name of that is Ozempic, which probably that's the most common one that people know about. In the original trials with semaglutide, you know, the patients were mostly obese, right? At the end of about a year of being on semaglutide, the average weight lost in the patients who are on semaglutide was about 15% of their body weight. Okay, which is a lot, right?
Yeah.
It's a lot.
Yeah.
They actually did a follow-up trial on those patients. So remember, at the end of the trial, they stopped the medication cold turkey, right? After a year after that, they actually caught up with those patients who were on semaglutide just to see how they were doing. And the answer was is that they found out that those patients, most of them on average, gained back 2/3 of the weight that they had lost. So if you think about that, the average patient on semaglutide after a year lost 15%. 1 year later, being totally off semaglutide, they gained back 10%. So it's not like they all of a sudden gain back 25% or something more, right? So that's kind of one of the myths out there, is that you're going to gain back more. Is there weight regain? There is. And why is that? Because it's really hard to come off the medication, right? Remember what we talked about, the appetite suppression, the fullness. I mean, that's once you start taking off that medication, guess what? That appetite starts coming back. It's a noticeable thing, right? It doesn't bounce back and make you want to eat everything in sight, but it's a noticeable thing. And so a couple of things that we've learned in our practice to help with that for patients who want to come off the medication, that's a personal decision. You know, a lot of people that we have, they want to stay on it. They love it and they're healthier and it's great, right? Patients who want to come off, they can do that too. Couple methodologies we incorporate. Number one, we have them taper off the medication. So instead of just stopping the medication cold turkey, if they're on, depending on what dose they're on, we'll decrease their dose and see how they do, and finally keep decreasing the dose, and then actually spread out their doses. So instead of doing a once a week injection, they do it every 2 weeks, every 3 weeks, every 4 weeks. So kind of slowly coming off, that helps. But really, the reality is that you have to mentally prepare yourself to come off the medication. It's not easy. It is absolutely doable, right? But remember, these medications are designed, yes, they can help you lose weight, but you have to really concentrate on what you're eating, your activity level, because if you decide to come off the medication, you have to remember, like, you have to stay with that routine. So
Yeah.
if you start eating an extra bag of chips every single day, those calories add up days and months and years later. So you will gain weight back if you're eating more than you had been before.
Yeah, for sure. And I want to talk a little bit more about some of the other side effects, just so people understand what they
Yeah,
may experience.
sure.
So,
Yep.
some of the other side effects that I've heard about is stomach pains, nausea, all those things. How often is that happening in patients? Because obviously it makes sense, right? It's affecting your gut. So, like,
Yeah.
what percentage of people are expecting that, and does that wean over time? Like, what's that look like?
So overall, the most common side effects are those gastrointestinal side effects you mentioned. And like you said, it makes sense, right? It's delaying the process your stomach can empty. So it's messing around with your gut. So it can cause those symptoms. In about 15% of patients, the most common side effect overall is nausea. Now, the good news about that is it's usually right when you start the medication. So after your first injection, you might feel nauseated. It's self-limited. So you're not going to feel nauseated for days on end, right? And yes, usually your body gets used to it, you know. So we actually send our patients a little prescription for an anti-nausea medication. This comes with their initial prescription, just in case they feel that way, because no one wants to feel that way.
Yeah.
But like I said, everyone is different, right? So if we tell patients specifically, hey, if you feel nauseated for days on end, you need to contact us because that means we need to decrease your dose. As simple as that, right? Other side effects too. Constipation is a common one. So I've pretty much been telling every patient, hey, you know what? Make sure your fiber intake is good, or take a fiber supplement every day just to prevent that from happening. We haven't really had any patients get to the point where they're vomiting. You see these stories of patients getting nausea and vomiting and landing in like the emergency department. We tell our patients, listen to your body. If you're nauseated, you're not going to keep increasing your dose like per the protocol, like, because then you're going to get vomiting and then you're going to get sick. If you're nauseated, reach out to your patient care coordinator. We'll have you decrease your dose. We can find a dose that works for you.
Yeah, totally. And then of course the famous one, Scott Disick's face pops in my head, the Ozempic face. What is going on there? Because I don't know if Scott Disick was on Ozempic, but that's the photo they use, right? So what?
Yeah,
By the way, I don't watch that show. I just know who he is because of pop culture. But
sure.
is that a real thing? Like, what are you seeing people's faces doing?
So here's the thing, right? That has nothing to do with the medication itself. Okay. If you take a person and they're, in their 30s, 40s, 50s, etc., you get wrinkles naturally. Okay. One of the benefits of being overweight is that, guess what? That fat, it fills in everywhere. It's not just your belly, it's not just your bottom, or it's everywhere in your body. So if you take someone who is obese or overweight and they get down to a normal, healthy BMI, whether they're taking a GLP-1 medication, whether they're doing it themselves, it doesn't matter, and you lose a lot of weight, those wrinkles are going to come out. And that's just because, you know what, you've had that fat in there for that long, and now it's being revealed. So it doesn't have anything to do with the medications themselves. That has everything to do with being obese in the first place and then losing weight and being older. So,
Yeah, that makes total sense. And
yeah.
it's just a fascinating thing because I think it's good to have these conversations in a long form kind of format because you know people will watch a reel and go, okay, I can't take that because of this or
Yeah.
this, right? And I love how you guys handle. Talk a little bit about the process, and then I want to get into testosterone and all that stuff. But talk a little
Yeah.
bit about the
Yeah, sure.
process of how people work with you guys. Do they have to be local because you have 4 locations across the country? What does that all look like?
So for the strictly weight loss medications, we only treat patients in those certain states. So Ohio, right? And I think we'll talk about this in a little bit, but where our clinics are: Ohio, Illinois, and also in Indiana, because that's where our clinics are. Patients don't have to actually physically come in for those medications. We can actually prescribe those through an evaluation and a telemedicine consultation. The only thing that we require for those visits, obviously, is for your electronic, you're going to submit your whole medical history form with your medical problems, whatever you have, and the medications that you're on. We'll review that with you. We also require just a small amount of blood work. It's called a comprehensive metabolic panel. That can come from us, because we have phlebotomists in our clinics, or we can send an order to LabCorp or wherever you want to get blood drawn. Or if it's within a certain amount of time, we can use your own blood work that you've gotten through your primary care doctor within a certain time to look at that. And that's just to make sure, hey, you know what, your electrolytes are okay, your liver and your kidneys are okay, you're okay for this medication. That's all we require. And when the patient after that, we gather all that data. Then we have the patient set up with, again, usually a telemedicine consultation with one of our providers. And after discussing the benefits and, the potential risks of the medication, that's pretty much it. After that conversation, the patient's patient care coordinator will reach back to the patient, discuss everything else, any questions they have, the pricing, et cetera. And after that, if everything's in agreement, we send the medication right to your doorstep. We teach you how to use the medication, how to administer the medication, what dosage you should be on, et cetera. It comes in a nice box with a QR code where you can scan it with your phone, and it tells you pretty much everything you need to know.
Yeah,
Make it
that's
very
perfect.
easy.
Yeah, and you said,
Yeah.
so I'm in Pennsylvania, so I wouldn't be able to utilize you guys.
So interestingly, I do have my Pennsylvania license, and we do have a cohort of patients in Pennsylvania. So I have patients in Pennsylvania through Affinity. So technically, yes, you could.
Interesting. Okay, cool. So that's obviously
Yeah.
always good information to know. And I want to switch gears a little bit, and I want to talk about TRT, testosterone, hormone imbalances, all that stuff. Obviously, at 40, these are concerns of mine now, right? It's harder for me to lose weight, it's harder for me to build muscle, it's harder for me to have the energy I used to have across the board. Talk a little bit about that treatment and how you guys kind of utilize that, and why again is that over the last couple years has become so much more prominent and a lot more people are talking about it.
Sure. And first of all, we've our Affinity Whole Health, we've been doing mainly testosterone therapy in men for over a decade. I mean, that's our bread and butter. We've been doing that for a very long time. We have many patients, many healthy and satisfied patients with us. So we've been doing that for a long time. It's really only the past few years when we started doing the GLP-1s for weight loss. But going back to your original question, testosterone, the problem with it is that it's a medication that's been abused for so long, mainly in the fitness industry, right, for whatever reason. And so it kind of has this stigma where, hey, why would I be on testosterone? I don't want to look like, Arnold Schwarzenegger or whatever, right? That's not my goal. But the reality is that we've had so many good trials, good data showing, hey, if you're a guy, right, in your 30s, 40s, 50s, 60s, whatever, and you have any of these constellation of symptoms that are pretty vague. I mean, low energy, decreased motivation, low libido, sexual dysfunction like erectile dysfunction. You mentioned, decreased muscle mass, increasing fat. If you have any of those symptoms, you should really get your labs checked out because you never know. You might have a testosterone level that's low, and if you correct it, man, I mean, it can help with all those things. So it's not just about working out and building muscle. Yes, it can. That is the hormone that is responsible for muscle protein synthesis, so it does help with that. But really, just the energy, and the libido things and the motivation. That's probably the most common reason why guys come to us. It's really for those issues, and we can help them out.
Yeah. So what's a good number to look at? So I've gotten my blood work done, so I know what my testosterone levels are.
Yeah.
What's a good number for a 40-year-old male to be at as far as testosterone levels?
The level thing is an interesting question. And the reality is, if you look at a scale, and it doesn't matter what lab you're using, because they all use a slightly different scale, the scale of what is normal to what is at the higher level of normal is gigantic. It's usually about from 250 nanograms per deciliter to 1,000 nanograms per deciliter. It's huge.
Yeah.
And the reason for that is because every guy is different, right? So, I mean, you can have a guy who has a testosterone level of 300, right? That's on the low side, and he feels totally fine. And if that's the case, then hey, I mean, you don't need to do anything, right? If you'll still feel like that you're 21 years old when our testosterone levels peaked, you don't need to do anything, right? You have another guy who has a testosterone level that's exactly the same, lives a similar lifestyle, likes to work out, or et cetera, has a family, has a job, and he feels terrible, right? He has to take a nap every afternoon. He doesn't have time to really get through the day. He wants more time to spend with his kids, but he's tired. He has issues with his significant other. I mean, all those kinds of things. It's really very individualized care. I mean, every guy is different.
Yeah, it's fascinating. So what are some of the things beyond energy levels and sexual health and all those things can testosterone help you with? Because what I'm what I've been seeing, and I've spoken at some fitness events, and of course, it's a hot topic that they talk about at these things. I don't talk about fitness,
Yeah.
but I happen to
Yeah.
speak at these things about other stuff. But with that being said, like, what else can it help you with? Because it seems like people are talking about it like it's a miracle treatment.
I think just the overall sense of well-being that guys get if we get their hormones into a good, healthy level. And again, we're keeping you guys in a physiologic level. We're not going to put you on a testosterone dose and get you twice what's supposed to be normal, right? We want to get you to that upper limit of normal. That's kind of the sweet spot, right? Especially looking at your free testosterone level, which is a calculated value from your total testosterone level. Getting a little technical, but in terms of your original question, the general sense of well-being is one. Motivation is another one. Some guys have, quite frankly, depressive symptoms, and they get on testosterone and they feel great. They don't have that anymore. And of course, not to mention, you're overall going to be healthier because if you're going and you're working out and you're trying to do what you're supposed to do, but you do not get any results, right? How many of us are like that? I mean, you see the guy, and if you go to the gym, there's many guys there who they've been there for years. They look exactly the same, right?
Yeah.
It's people like that where it can really help because it can help with your muscle protein synthesis, like I discussed before. That increases your overall metabolism. Guess what? That helps you burn fat. That makes you metabolically more healthy.
Yeah. No, it totally makes sense. Now, obviously, you're in great shape. What's a normal day look like for you as far as what you're eating, your workout habits, all that stuff? Because I think the end of the day, what we're talking about here is, are people able to create the habits to live a healthy lifestyle beyond these drugs, right? So, like, what does a normal day look like for you?
So for me, and this, I'll just kind of describe what we basically tell patients to do. I mean, really, based on the latest data, what should you be doing? And we kind of talked about this a little earlier with, hey, treat cardiovascular exercise like cycling or swimming or running or walking or whatever, cardiovascular exercise equally as important as strength training. So you have to incorporate some type of strength training. I think that's super important, right? Especially to get the benefits from testosterone with your body composition, right? So I think, for me, I like to work out a lot. So I work out probably 5 or 6 days a week. But that being said, not everyone needs to do that. Okay. What I found that helps me a lot is I have a Peloton bike at home, and it has, it's not just cycling, which I'm not a cycler at all. It has all types of other workouts on it. I mean, it has strength workouts, it has yoga workouts, it has metabolic conditioning workouts, so a ton of different things. So for me and for people like us who are strapped for time, you don't have the time to be spending, an hour or two at the gym every single day. That really helps because if I only have 20 minutes in the day, I can get in a good 20-minute workout, you know?
Yeah,
Uh,
something I just heard about. So I have a client who has a podcast in the health space, but for people in middle age. Her name's Natalie Jill. She just interviewed the founder of the Caro bike. Have you ever heard of this?
I haven't. No, tell me about
So
it.
apparently it's a new bike, and I guess the workout is it's like a short workout. You talk about crunch for time. It's like 3 to 5 minutes, but it
Wow.
gives you the cardiovascular health of like a 45-minute workout. It's fascinating to kind of look into it. So take a look at it. Shout out to Carol Bike, not a sponsor of the show. But
Yeah,
I'd be interested to hear from you, like if you look into that, if that even makes sense. But I did
definitely.
some research after hearing the episode, and I was like, this is pretty fascinating. So obviously, moving your body and all that stuff. What's a good diet for people to look at, right? Because when we look at this, you're hearing about the keto diet, the carnivore diet, the vegan diet, all these different things that have become hot topics over the course of the last 10 years. What is something that the basic everyday person can do? Because I tried keto for about 3 days, and I was like, this is the worst thing in the world. So what's
Me too.
what's a good diet? Dude, it's terrible.
So, all right, when you look at the overall nutritional data, and remember, studying what the perfect diet is impossible, right? Because you're asking basically clinical researchers to take a bunch of people and put them in a space and monitor every single thing they eat for like a year or 2 years or three. That's impossible to do. All these studies are based on, they're basically sending surveys to patients and asking them what they've eaten. I mean, there's a lot of error in that, so it's very difficult to study. But we try to keep it really simple. I find that if a patient comes to us, we talked about weight loss coaching initially and what we tell them. If you're going to tell them do this diet and count these grams and do this and do that, it's way too much stuff. All I tell them is, hey, listen, just treat protein, right? Good protein from meats, from fish, whatever. Treat that as the most important thing you can take into your body because it really is. And again, we talked about the muscle loss when you're on one of these GLP-1 medications. When I tell patients when they're sitting down to eat a meal, we typically have, right, a protein and a veggie and a starch or something like that. Eat the protein first. Don't even touch the other ones because chances are you might eat that protein and you might not want the other things, or you'll eat less of the other things. But the protein is key to prevent muscle loss. The other thing too, I forgot to mention too, is you're thinking about, hey, preventing muscle loss on these GLP-1 agonist medications, testosterone. Testosterone and these medications go so well together because you have one medication encouraging calorie restriction, which is what it does, right? Which is healthy because then you don't have to do an extreme diet. You have another medication that helps with retaining lean muscle mass. So if you talk about just a medication way to really transform your body, in other words, retain muscle mass or even gain muscle mass, while at the same time losing that fat that's so bad that causes all these medical conditions, those two medications are the best. I mean, that's the most you can do, you know.
Yeah. So go ahead.
I was going to say, aside from saying, hey, you know what, protein is the most important, eat almost as much as you can, because what a lot of data shows is that a good goal is about 1 gram per pound of body weight. That's a lot. A lot of people can't get that. And so if I tell patients that like it's too much, like they're not going to do it. And I'm not going to sit there and weigh my food and look at the grams every single day and take, I'm not going to do that myself. I don't expect patients to do that. I think the bottom line is, you know, getting more as active as you can be, doing whatever activity you like to do, but keeping in mind, hey, cardiovascular activity and strength training are equally as important. Whatever that means for you, go and do that. Whatever diet you like to do, I don't care about either, because all I want is that it's a high protein diet, you know? So you mentioned keto. Not a lot of people can do that. I can't do that. And guess what? You don't have to do that. You know, just make sure you get in the protein. You can have the carbs that you want. But again, because you're doing caloric restriction, which is probably the most effective way to lose weight, by the way, because you're not doing a crazy diet, you're just decreasing calories with the GLP-1 medications, it makes it a lot easier.
Yeah, for sure. And so obviously you guys are the one-stop shop for people who are looking to transform their lives in so many different ways, right? So talk me through the process with you guys. I know we talked about a little bit about the onboarding process, but I'm
Yeah.
the person who, whenever I do something, I want to make sure I'm doing it right. How do I
Yeah.
know throughout the process that I'm handling everything the right way? Who can I talk to? Like, what's that all look like?
And that has a lot to do with just our patient care coordinators. So one of the differentiating factors with our clinic is that we have dedicated patient care coordinators for every patient we have. So no matter if you're with us just for weight loss, just for hormone therapy, for both, right? You have a patient care coordinator who is physically in the clinic working side by side with our providers. And you have access to them whenever you want. You can call them, you can text them, you can email them. If you have any questions, they are there for you. And it's a real person. I mean, these are people that have worked with us for years. It's not like it's, you know, you call in and you're talking to someone in like another country or something. I mean, you know, these are actually real people we have, the boots on the ground. They're by far the way that we can take our service level to that highest level. And if there's ever a specific medical concern or question, the patient care coordinator sends it to the provider and we're back with the patient, you know? So we keep that communication to the highest level. I can't stress that enough.
No, I love that. And I think it's key too, right? Because you're injecting something into your body. And so
Yeah, exactly.
how can I make sure that I'm doing this the right way when, the clinic might not be right down the road or whatever the case would be. So I think that's a fascinating way to do it. So obviously with this show over the last 8.5 years, I've been able to interview high performers across the board, whether it be celebrities, comedians, doctors, so on and so forth. And I want to ask you a question that I ask every single person. It's a two-part question. The first part is, what is your definition of success? The second part is, what are 3 things you do every single day to ensure that success for yourself? Because you're a busy man, right? You obviously are working in an ER. You're overseeing this entire organization. What are the 3 things you do to ensure that success for yourself?
Honestly, I think the definition of success is just finding something that you love and finding something that you're passionate about. It doesn't matter what you're doing, right? As long as you're finding something that you love to do. My passion, obviously, I love practicing medicine, right? I practice at a level 1 trauma center as an ER physician, but my passion has always been just in the health and fitness, you know, area. And so this has been perfect for me. That's my simple definition of success, right? I also
I
have a
love it.
family that I care about too. I mean, if I can provide for them, that's fantastic. But just finding something that you're passionate about and you like, you know, and you enjoy to wake up every day and say, hey, you know what? I got to do this today, instead of waking up and saying, oh man, I got to do this today. I think that's success to me, simply. And
100%.
three things I do every day was the other question.
Yep.
Honestly, waking up in the morning and giving my family hugs and kisses. That's probably one of the most important things I can do. Got to do that at least once a day, you know, before I go to work, or if I'm working in the morning after I get home from work. Number 2 is probably just, you know, staying passionate about what you're doing. So looking at the latest data, looking at the latest research. I mean, medicine changes all the time. These medications, there are constantly studies being put out about them with, hey, you know what, we didn't know this about this, or hey, this dose might be better for patients, or hey, a patient should be on this too with this medication. So really me keeping up to date with the latest data is another thing. And number three, I would just say, again, probably just working with my team, communicating with our my team at Affinity Whole Health. I probably talk with them every single day. We're always brainstorming ideas, talking about things like that. I think those are the things that have really let me be successful in this area and in life.
I love it. So I wrap up every single interview with the same question, but before we get there, how do people get more information about Affinity? How can they follow along? How can they find out if it's right for them?
Sure. And I would just say, hey, you know what? We actually just released our new website. It just went live last month. It's affinitywholehealth.com. We pretty much revamped it. We have a big frequently asked questions section in there covering the common questions that we get from patients. We have a patient portal in there now where they can schedule their appointments and consultations. So again, kind of keeping that communication and convenience to the highest level. I would just direct them to our website, affinitywholehealth.com.
Love it. And so, like I said, I wrap up every single interview with the same question. Since the show is called The Growth Now Movement, that question is, in your life, what has been your biggest moment of growth?
Biggest moment, gosh, that's a tough one. That's a really hard one. I mean, I'm so fortunate to grow in pretty much all the things that I've done. It's very hard for me to pick one because I would think number one, I would say my family. I have married to an awesome wife, and we have two sons, age 6 and 4. So that's growth right there.
Yeah.
Trying to provide for them the best I can. Really doing as well as I can in the emergency department every day. I mean, I see thousands of patients a year. That really helps me grow as a person because I'm taking care of patients there. And I can't discount what we've done with Affinity. I mean, we've gone from a 2-clinic place in Ohio to recently expanding 2 years ago into Indianapolis, and last year we expanded into Chicago. So I go to those clinics and visit the providers and the team there. I think that growth I'm also very proud of as well.
I love it. Are you seeing more growth in the future for you guys?
A lot. I mean, we are very busy. We are very busy. I mean, when we opened up the clinic right outside of Indianapolis in Carmel, we had no idea how busy that was going to be. I mean, it was like 0 to 100 real quick. I mean, we were so busy. And shout out to our patient care coordinator, who's also the general manager out there. It was only him at the beginning, right? And this thing went so quickly. We got so many patients. So many patients came to us for help with hormone therapy and weight loss. It was almost overwhelming, but we're able to cover for it, and we're able to give those patients again that high level of service that we're used to giving our patients. So yeah, growth is ongoing for sure.
I love it. Dr. Koehler, thank you so much for coming on the show, debunking some myths and having this fun conversation, man. This was great.
Thank you so much, Justin. This was awesome. Thank you.